and is a crooked nose, complete blockage of the nose one side functionally, and the nose have a C-sept deviations, and there is no history of the trauma. Is 19-year-old male, and on photographic analysis looked at on the frontal view. This is the frontal view. So in the frontal view on examination looked at the first we check the symmetry of the nose. The symmetry of the nose is not symmetrical, and then the deviations of the nose is deviated towards the left sides. And then if you check the dorsal aesthetic line, there is very ill defined dorsal aesthetic line. And we just check the width of the nose. If you just compare, the nose is over wide at the base of the dorsum, and the tip is also asymmetrical, and look that the ala and the this columella ratio is also disproportionate. So in this frontal view, the nose is entirely deviated, and if we confirm all these frontal view finding, then look that this is the cephalic view. So look that the nose is entirely deviated on the one side, and the you can better appreciate this ala and the columella ratio. Now if you come on the profile view, look that in the profile view the dorsum is straight, but if you come on the tip, this ala and the columella ratio is so disproportionate. This axis part of this infratip lobule, the patient have a infratibule prominence. So he appear just like the droopy tip. And if you look that in this basal view, then look that the columella that in the central, but the caudal part of the septum is completely deviated on the left side. And look, the tip and the columella ratio is also disproportionate. Ideally that should be 2:1, and due to this under projecting of the nose, it appear is like over wide ala base. And if you compare in this oblique view, then you can better assess the condition of the ala on the both sides. So for such type of the case, how we correct? You just go the open approach. You just follow the 7 golden steps. First you infiltrate proper, and then septum, expose entire dorsum tip, and then the keys is the third step, the septum modifications. First you do the septoplasty, you complete separate the upper lateral and the septum, and then you do the septoplasty, and then septum reconstruction, the dorsum part of the septum reconstruction and the caudal part of the septum reconstruction, and you just mobilize the caudal part of the septum in the midline, and you fix it with the 40 PDA suture. So this is the third step. And then fourth step, bony pyramid modification. So because the one side of the nose is deviated, so you need the different type of the proper osteotomies for pyramid corrections. And then like the superior part of the septum corrections, either you use the spreader graft or the spreader flap. It's depend on the availability of the material. And then the tip corrections for the tip modifications in such type of the patient, because this prominent infratip lobule, so you need the good septal extension graft. And then after the good strong foundation of the caudal part of the septum, you just advancement of this medial crust on that septal extension graft, that means modified tongue in groove. So you reduce this prominent excessive columella show, and then rest of the same like your tip sutures and the close with the 6 vicryl rapids. Most probably the lateral crust, they don't have the deformity in this case. So this is the typical 7 golden steps for correction of this crooked nose deformity.